Assalamu alaikum. Welcome to Journal Club of this week with a randomized clinical trial done by Turkish group titled Apicoectomy versus apical curettage in combination with or without leukocyte platelet-rich fibrin application. Due to a limited surgical treatment options for teeth with compromised crown-to-root ratio, apicoectomy is contraindicated as it will jeopardize the tooth restoration and cause tooth mobility. Apical curettage only without root resection has been reported in the literature merely in case reports. Therefore, the present study aimed to assess the clinical efficacy of periapical curettage and apicoectomy procedures in combination with the use of leukocyte platelet-rich fibrin in the management of teeth with large periapical lesions. This is a single-center, prospective, randomized, controlled clinical trial conducted at the Department of Endodontics and Oral Maxillofacial Surgery in the Faculty of Dentistry at Istanbul Medipol University. Out of 1,100 individuals assessed for eligibility, 1,036 were excluded, leaving 64 participants who were randomized equally using block randomization and random number generator into 4 groups, 16 each. Retrograde obturation with platelet-rich fibrin, orthograde alone, and orthograde obturation with platelet-rich fibrin. Each group received its respective intervention as planned, with no loss to follow-up reported over a course of 12 months. These are 4 representative cases of each group over the course of 12 months. For the results, there was no statistically significant difference observed between the groups in terms of post-operative PAI index, VAS score, swelling, mobility, tenderness to palpation, or fistula over the study period. The periapical index score were not significantly different among the groups pre-operatively or at 1 week, 1 month, or 12 months post-operatively. However, there was statistically significant decrease in periapical lesion area healing percentages between the groups at 1, 6, and 9 months. The retrograde obturation plus the platelet-rich fibrin group consistently showed the highest periapical lesion area healing rates across all follow-up periods, while the orthograde group showed the lowest healing rates. In conclusion, combining root end resection and retrograde MTA obturation with the platelet-rich fibrin enhances short and long-term healing of periapical lesions, particularly in large defects. However, when the crown-to-root ratio is unfavorable, a less invasive approach, periapical curettage with orthograde MTA obturation and platelet-rich fibrin, provides a suitable alternative while preserving tooth stability. However, for limitation of this study, it is only done for short term, only 12 months follow-up. The small sample size and also the periapical healing was only assessed via 2D imaging periapical radiograph with no CBCT assessment. And also for the treatment sequence, they did the surgery at the day of obturation using air plus sealer. They did not allow for complete setting of the sealer and the MTA apical plug, which could risk washing out during the surgical curettage and saline irrigation as mentioned in the paper. And thank you.